Well, good evening, good evening, good evening. We are with another show with Ask Dr. Afflalo. Dr. Afflalo, you have been moving around the world, the country, impacting people one examination at a time. Let's just start off very, very quickly to announce our community health fair, health and resource fair coming up on first Wednesday. Let's just talk about that real quick as we get ready to start the show.
Sure. Well, thanks for having me this weekend once again. The monthly Community Health and Resource Fair is held every first Wednesday of the month. February through December, we go dark in January. It is open from 10 to 3, and we provide all free services there. There's usually about 45 to 50 vendors sharing their resources and their information that they want to talk about. But what we do is offer free medical screening. So blood pressure, blood sugar, diabetes, A1C, cholesterol screening, breast exams. Those are the things that we offer free that we want everyone to at least know their numbers and be able to respond appropriately if their numbers are elevated or out of control. We also have other free services, including free eye exams and glasses, pet services. Free produce is the most important thing for people to come and get fresh produce each and every month. So those are the things that we offer, along with a lot of other services, but that's the main thing.
Is the service that used to deliver fresh fruit to people's homes and vegetables, is that program still going?
Yeah, they're on the last, this was 3 years, and it's on the last year right now until we get more funding. And so we have our last cohort that started in January. This particular year is only 6 months, delivering every week. The first 2 years were twice a month for the whole 12 months.
Yeah, I thought that was an outstanding program, not only because you got to experience different fruits and vegetables, but it was an easy fix where they would literally drop it off at your house. And what a service! What a service to have something delivered. You know, normally people are looking for DoorDash and Instacart and all the other things, and this was being given as a free service, which was this outstanding. And I believe so many people in our community were able to take advantage of it.
Yeah, and the great thing about it was a win-win situation. We were actually supporting our local farmers. So the government, the agricultural, the grant that was given to the local farmers to grow produce, and then they in turn would deliver it to families in need. And basically, I signed up a lot of seniors at the 4th District Senior Center, a lot of the people in the community that came to my health fair over the last 2.5 years. And so people that benefit from it, they got to experience new fruits and veggies. And the good thing about it is they provided recipes for things and how to take care of it, how to store it, and how to cook it. So we learned a few things, but mostly we're getting fresh, unadulterated produce delivered to the home.
Well, this show is called Ask Dr. Afflalo, and I know people have questions that they would like to ask you, and we're going to talk about a topic. But with all the transitions that's happening in America today, and with things being shut down and different services being canceled, some people think that America will become sicker because of the lack of governmental support. What encouraging word can you give those people that are out there that are concerned about the health and wellness of our nation?
Well, I mean, they probably do have a right to be concerned, but all is not lost. At the end of the day, it still is in the Lord's hands. So, yes, services are being cut, federal funding's being cut. So some of the federally qualified clinics that we have in our community, the family health centers, San Ysidro Health, the neighborhood community, all of those federally qualified funded programs are going to lose some funding, which means they're going to be cuts. But that doesn't mean that they can't go in there and be seen. We're obligated to take care of our uninsured and underinsured population. So still go in and seek services. At some point, they may need to participate in what might have been free before. Maybe they're going to ask for a small copay or something. I'm not sure. But as it stands now, there's still opportunity. There's still people out there that want to serve the community, even with funding. They'll have to look for funding in other places. We're just realizing we cannot rely on the federal government 100% anymore because it depends on who's in the position, and they're the ones that call the shots in terms of sponsoring things. So people are being creative in terms of how to support their programs. But that's the one thing about our health fair once a month. We can screen the basic things that keep people healthy in terms of knowing what their numbers are. if their blood pressure is high, if their sugar, if they have diabetes at all, if they have heart disease, and then trying to get them the help that they need to make sure that those things don't go either undiagnosed or untreated.
And so for us to combat with the changes that are taking place in America right now, the big thing would be is to make sure that we stay healthy, and that is to take advantage of the clinics and continue to do the things from healthy living, healthy eating, exercising, to make sure that we're able to go ahead and combat the things that we do face.
Yeah, I would just say if you can stay ahead of the game and stay healthy, as you mentioned, it decreases the chance of you having to land up with either chronic conditions that are going to make you disabled or land you up in a hospital. So if you can make better choices now, that will try to curb it. And show up at the doorstep of the clinics. I mean, unless they tell you, no, we're closed, you need to continue to seek health care as you have been.
Well, tonight we're going to talk about liver health.
Kidney
And,
disease.
Is it liver or
Yeah,
kidney?
we did liver last month.
We did liver last
Yeah.
time. See, that's the problem, Dr. Afflalo. We got so many different organs in our body. I get the liver and the kidney mixed up. I'm going to ask, is there two of what? Or do we got two livers and one kidney, or two kidneys and one liver? Let's just jump on in it today. We're going to talk about kidney disease and kidney health.
Yes,
And
absolutely.
I want to know everything about kidney. Because, growing up, you hear about a kidney punch. And I'm like, what's a kidney punch? And what's that about? And why does it make people bend over? And how many kidneys do you have? And so can you just break it down and tell us what is even the function of a kidney?
Well, the kidney, you have two kidneys, one on each side to the mid to upper part of your back, right? So it's not in your front area. And basically what it does is it helps to filter the toxins in your system, helps to filter the waste, and then it also helps to decrease the amount of fluids in your body. So it's a filtering process. When that doesn't work, you're in trouble. And it maintains the fluid balance in your body, which is important, right? Because if you have fluid overload, obviously people get swelling in their legs, but they also get fluid overload into their heart and lungs. So we do want to make sure we regulate the fluid in our body, filter it, but then it also controls our blood pressure. It is key to helping our blood pressure stay under control.
So let me ask you a question now. Where is the kidney in say, for instance, if I drink a lot of water, how does my water get to the kidney? Is it directly to the kidney? Does it come through the stomach, or is it absorbed and then they're pulling out of the blood? How does the kidney actually function?
Yeah, so it is a filtering organs, and everything comes through your stomach, through the mouth, down to the esophagus, through the stomach, and then into the bloodstream. Into the bloodstream, then it goes through kidneys, things like that, through your liver. So the kidneys filter what's in the blood. So the toxins, the waste, and everything that's been pulled, that the nutrients have been pulled out in the stomach. The liver does its thing of processing certain things, and it gets down into the kidneys. It filters that waste and gets rid of it.
Stomach to the liver first.
The liver comes there, yes. I mean, things are going all over, but the liver processes things with there's enzymes and storage, and the insulin breaks down certain things and stores your sugar. So every organ has its role.
So they're working simultaneously and not one after another.
Yeah, they're working all at the same time.
Okay.
Yes.
All right, because sometimes in the plumbing system, you go through the pipe, then you go through the garbage disposal through the pipe, then the pipe goes somewhere else to a filtering station, and it has like a process. But what you're saying is that in this system, all the organs are working simultaneously doing their job. So liver disease. Because I really want to get into this liver thing, because I hear a lot about
Kidney.
not the kidney. See, you done got
You're
me
still
with the
stuck on
liver.
our last
Yeah.
month's topic.
The kidney disease.
Yes.
And kidney issues. And that now let me just make sure kidneys is connected to dialysis, right?
Yes.
Okay, so let's talk about that.
Yes. So before we get to dialysis, because that's more of a treatment of a problem, let's kind of go through, and I have my outline here so I stay on track and keep you on track.
Yes, ma'am. I appreciate that.
So there's so many things that can affect the kidneys. The kidneys are functioning well if you treat them properly. If you hydrate them but don't overdo it, if you don't tax them with like sodas and all kinds of other inappropriate foods, and we'll get to that later. There is acute kidney disease where your body either kind of the kidneys shut down because of some illness of some sort or medication of some sort, and then it doesn't function well acutely. It can respond and come back. Chronic kidney
Well,
disease.
now you got to tell them, what does acutely mean?
Acute means like something that happens suddenly.
Okay.
Like say you get a febrile illness, a high fever, and you take an antibiotic, and it's nephrotoxic, which is toxic to the kidney. It can kind of knock out your kidneys temporarily. And when we see that, then we have to stop the medication, because we can tell by a blood test if your kidneys are all of a sudden not doing well, and or if your urine starts turning to a Coca-Cola color when it was just fine. So depending, and acute tends to happen more in a hospital setting or an acute injury, but acute settings, it can be reversed, if we undo what we've done. Stop taking the anti-inflammatory, stop taking the certain nephrotoxic or toxic medications to the kidneys, we can get past that and usually respond well. Chronic kidney disease tends to be a slow progressive injury to the kidneys that after a period of time it does not function well. It does not filter well. It does not get rid of the fluid as well, and it's over time. And chronic kidney disease, you cannot reverse that, okay? So you have a stage 1 through 5. 1 and 2, your doctor's going to start telling you, hey, your kidneys aren't working as well. Be careful with X, Y, and Z. Control your blood pressure. Control your blood sugar. Diabetes and blood pressure are two of the main things that can knock out your kidneys. And so when I always tell people that when you go to a dialysis unit, it's mostly Hispanic and African Americans that are in there, because we tend to have chronic medical conditions, mostly the blood pressure, diabetes, heart disease, and they've been chronically not well taken care of, which over time has been knocking out our kidneys. So if you have stage 1, 2, we're warning you, please control your blood pressure well, please control your diabetes well, so you do not progress to a more latent stage of disease, of renal disease, which is stage 3, 4, and 5. When you get to stage 5, you're at an end stage kidney disease. And that's when you're looking at some treatments, right? So let me just go through some of the types of kidney disease that I have down here. Obviously, I spoke a little bit about acute renal disease, and that's something that comes on suddenly. It usually has a severe decrease in your kidney function, but it can be reversed. The chronic kidney disease, as I said, is slow and progressive over time. You just lose the function. You can't filter as well, and it gradually gets to a point where you just are going to need some help or you're not going to do well. Nephritis. So nephritis is inflammation of the kidney. That can be any inflammation, can be caused by anything, medications or stuff. Nephrosis is more of a chronic inflammatory process. These are terms that you may not ever hear, but if you happen to hear your doctor mentions it to you, then you want to ask more questions about that inflammation and how did it happen and how can we reverse it. There's polycystic kidney disease. Some people have it, born with it, and it's a lot of cysts on their kidneys. And so sometimes it makes the kidneys not function as well.
Is that on the inside or outside?
It's the whole kidney. You look at it and it's full of cysts.
Okay.
So it can still function, but if you start having chronic kidney disease from it, we need to manage that. So that's one thing. Kidney stones, is a type of kidney disease, but it is reversible if the stones are passed. If the stones are too large and they can't be, blasted and broken down into small pieces to be passed, then they have to go in and surgically remove it if it's blocking something. If it's sitting there minding its own business, not causing any kidney problems, we leave the stone alone. But if it's blocking a duct or the tube that passes the urine down to the bladder, we have to unblock that tube.
And for people that have kidney stones, they say it's very, very, very painful.
Oh, God, yes.
And how do they blast them? Because they say they try to get medicine and everything else. But how do you blast the kidney stone to make them into little pieces?
Well, do some ultrasonic treatment to it.
Really?
To just kind of break it up into pulverize it.
Okay.
And so, but the process is not painful. The passing of all those stones are painful.
Yes.
So, yes, because every little stone, it looks like a grain of sand, but it's like delivering a baby. Men are horrible with kidney stones.
Yes,
They're
yes.
writhing around, and you can't console them, and you need all kinds of narcotics to get them under control. And the treatment is really hydration and medications in terms of pain management until you can pass that stone. Yeah. So we try to tell people stay away from sodas and things like that causes your kidneys to work harder, but also form kidney stones because it has more calcium in it. Some of them are calcium oxalate stones. So you won't know what your stone's made of until you pass it, collect it in a strainer, and then, we tell you, hey, it's a calcium oxalate stone, which is the more common one. And then do water. You know, your kidneys love water. It does not like sodas and energy drinks and, you know, sports drinks and all that. It's just it makes it work too hard, right?
Okay, so Dr. Afflalo, for the folks that like tea and coffee and things of that nature, if we drink water, how is coffee and tea on the kidney?
Coffee can be hard because anything caffeinated can be on the harder side of it. So
Okay.
if you have like an herbal tea, that's not that big of a deal because it's basically water with a flavor in it that doesn't have other types of things in it, the caffeine and stuff. So that would be a healthier choice. Caffeine is going to be hard on everything. It makes the blood pressure go up, makes the heart rate go up, all kinds of things, right? So I would minimize the amount of caffeine and maybe chase it with lots of water so that your kidneys are happy.
Now, let me ask you a question. You talked about sodas, and I guess that includes the alcoholic drinks.
Yes.
Now, what about Kool-Aid?
Well, Kool-Aid doesn't have caffeine and stuff in it, but it does have a ton of sugar. One little package and 4 cups of sugar.
Yeah.
So the sugar is also not good,
Okay.
because it still has to process that. So I would say minimize any sugar sweetened beverage.
Okay. Including juice, natural juices.
Yeah, natural juice is just full of sugar. Have the fruit.
Okay.
And if you're going to have a juice, have a very small amount. Kids, sometimes they'll give them a small amount and chase it with some water, half and half. Still, you don't need a lot of it. I'd rather people just have a fruit with the fiber. You get enough natural sugar and fiber with the fruit.
Yeah. In my older age, I find that fruit juice 100% is just too sweet, so I have to cut it with water if I'm going to drink it. So I do like 2/3 versus 1/3. 2/3 worth of water and 1/3 of juice.
You might as well just have the water. But anyway,
I
or
just-
that's to flavor your
Yeah,
water.
it was just a flavor.
Flavor, okay.
Okay.
Orange juice flavored water.
Oh no, I don't like orange juice.
Apple juice flavored water.
In actuality, cranberry juice.
Yeah, cranberry's not bad.
Yeah.
Yeah, it helps. We tell our women to drink cranberry juice because it helps with their urinary tract system. So
Okay.
yeah, or the urine, or if they're diabetic, we tell them to take the cranberry tablets instead.
Okay.
Yeah. So and then one other thing for kidney disease is kidney infections. So you can get something called pyelonephritis. You get a kidney infection. We need to treat that with antibiotics. And some of the risk factors, I'll go through the risk factors of what causes kidney disease, and there are many, but the most important 2 that I mentioned was diabetes and high blood pressure. Those are the most common ones that cause chronic kidney disease, CKD, CKD1 through CKD5. Family history of kidney disease makes you more predisposed to getting kidney disease. Age, the older you are, you more likely will have some problems with your kidneys if you don't take care of them well. Other risk factors would be heart disease, obesity, and any kind of previous kidney damage. Those things will put you at risk for chronic kidney disease. And then certainly if you have high cholesterol, that affects every artery going to every organ. So if your arteries are now clogged with cholesterol, it decreases the flow of blood to your kidneys, those types of things. So let's take a little bit of a look on terms of, because we're going to get to that dialysis, but we have to kind of talk of some other things. Let's talk a little bit about the stages of kidney disease. So I mentioned that chronic kidney disease, there's stage 1 through 5. So 1 and 2 are pretty mild. Don't have to do much about it other than control your blood pressure, control your diabetes, and try to stay away from things that are going to make your kidneys work harder. Okay?
How do you know if you're at stage 1 or stage 2?
Yeah. That's where you should know your numbers. So if you go in annually to get your annual exam, we will do your provider should do a chronic creatinine level and a GFR, glomerular filtration rate. It tells you how well your kidneys are filtering, and it tells you where the function is. So a creatinine, it should be like a 0.4 to 1. When you start going up into 2, 3, 4, 5, 8, when your creatinine is 8, you're talking about some serious chronic kidney disease.
Okay.
So less than 1 is considered normal, 1 to 1.1. But when your creatinine level starts climbing and your GFR starts decreasing, so you're not filtering at 90 now, you're filtering at 30, and you're filtering at 15, then you're talking about CKD 3, 4, 5, right? So the numbers tell you where you are, and your doctor is the only one that would be able to tell you what stage of kidney failure you're going through. So the early stages are more the 1 through 3. When you start getting into 4 and 5, it gets into the later stages. And then you start feeling, you can have symptoms. So the first 1 to 3 usually don't feel anything. So you're going around just fine, But when you start getting a CKD4, chronic kidney disease stage 4, you're looking at fatigue. You're just tired all the time. You got all these toxins in there that you can't filter that well. Your ankles and your feet are swollen. Your hands get swollen. You get a little bit of shortness of breath. You might have nausea. And then your urine changes. You might not be producing as much urine now because your kidneys aren't functioning as well. It's not filtering as well. And then when it becomes very severe, you can actually have like severe abdominal pain, diarrhea, vomiting, fever, nosebleeds, rashes, you name it. You can have a little of everything when you start getting into chronic kidney disease stage 5. So obviously, if you get there, you want to know what to do. You can still, even at 3 through 5, manage it properly before you have to, when you get to end stage, then you're talking about dialysis, which I'll go into in a minute. But let's talk about just management and treatment. Management, you're going to need to do lifestyle changes, which is what we're trying to tell you from the beginning of the game so you don't get to chronic kidney disease.
Yeah, 'cause I just did a whole battery of tests, so I had to go and check my
creatinine level.
Yeah, I'm good.
What does it say? 0.9?
No, it might. Hold on, let me go back. I think it was 0.92.
Okay, and then look up your GFR, which should be close by.
Okay, I'm gonna look it up.
Okay, I'll keep talking to the audience until you find it. So the lifestyle changes are going to be definitely controlling your blood pressure, managing your blood sugar levels, maintaining a healthy weight, and exercising regularly. Those are the things you mentioned earlier. So that's what we tell people to do regardless, because that'll prevent you from getting, all the chronic conditions if you just can't control what you do have. Then there are medications, but the medications are to treat your chronic diseases. Take your blood pressure medicine because it was prescribed, and you need to keep your blood pressure under control. If you're having side effects to the medication, please, if you're going to stop because there's bad side effects, please let your doctor know or your provider know, because they need to know that you're no longer on it. Now your blood pressure's higher than normal, and it's going to start affecting your kidneys over time. So medications are important to manage the blood pressure, to manage the high cholesterol, and all the other associated conditions that you have. Then we start getting into dialysis and transplants. So I'll go into more dialysis in a little while, but dialysis is basically just a machine that's going to filter the blood that the kidneys can no longer do. It can no longer get rid of all the waste and manage your fluids. So you get hooked up to a machine, you're sitting there for a good 4 hours or so. It takes off your blood, filters it, and puts it back in. And it can be kind of draining and tiring. Most people after dialysis don't feel so great. They're tired and a little lethargic. That's to be expected. They might have muscle cramps because it's really kind of adjusting all of your electrolytes and things like that. And then there's kidney transplant. So if you've gotten to the point where you are fortunate enough to get a kidney that matches you, whether it's from a deceased donor, someone that just passed away, or whether they were conscientious enough to mark on their thing that they want to donate their organs, which I recommend to everyone, please donate your organs, because someone, yourself or a loved one, is going to be on a list waiting, especially for kidneys. People are on the list 5-10 years waiting for a kidney. And then kidneys, unfortunately, we have accidents all the time. Good kidneys just go into the ground with the rest of the body, which is unfortunate because we could save more lives if we donated our organs. So I'm a big proponent on donating organs, especially if they're healthy. They'll let you know if they're not healthy enough. If you have cancer or something, they're not going to you're not a donor. But if you've got healthy organs, please donate them. Anyway, the transplant, so you can have a deceased donor transplant, or you can have a live one, which means if a family member matches you, a spouse, a sibling, a sibling, a parent or something, a cousin, and they match your type, blood type and HLA type, then they can donate one of their kidneys for you to live another 15, 20 years. So that's transplant.
Wait a minute. So you mean to tell me that only 15, 20 years, if I'm going to give up a kidney, I need you to live a lot longer than that. Is there a timeline on?
The average for dialysis, the average person can go, usually goes 5 to 10 years, but they can go longer. There's people that's been on dialysis for 10 to 20 years. It just depends on how well you control the rest of it. I know I'm getting to the transplant. I know if you're going to give up an organ,
Yeah.
but on dialysis, you can live pretty long if you control your blood pressure and diabetes and you stay on your dialysis 3 days a week, or if you're at home every day. Now, if you're fortunate enough to find someone that wants to donate a kidney that is a family member of yours, you can get 15 to 20 years on average. Now, mind you, a few more can get a little longer. That's on a deceased organ, 15 to 20 years, and on a live organ, like 20 to 25 years. So it just 5 to 10, 15 to 20, 5 to 10, 10 to 15, 20 to 25 type of thing. You can get about 20 good years out of a live thing. And if you take care of everything else, like I have a patient that when I met her, she had already had and she was a little younger than me, already had a kidney transplant. And then that one eventually failed. And she was fortunate enough to get another kidney transplant maybe a year ago and is doing fine. She was fortunate. Many people, African-American people, do not ever get a kidney. So, and then there was one other gentleman that I knew in church that got a kidney about 4 years ago and is doing great. But he was on the list for a very long time.
Yeah, I have an aunt that had a kidney transplant, I think maybe about 5 or 6 years ago.
Yeah.
And doing very well. Let me ask you a question, though.
Mm-hmm.
Now, if I give up a kidney, how does that affect my life
Creatinine?
expectancy?
Oh. You should be fine. You can live with one kidney as long as you don't beat up that one. So then you need to actually have a kidney healthy diet and stuff too. Cut out the sugary beverages, the alcohol, the tobacco, anything that can, and heavy proteins. The kidney have to work harder to process that. So they do give you a kidney. What do you call it? A kidney diet, right? So that you can eat properly.
So you mean to tell me that, if I only have one kidney, no more steak?
You just can't have steak every day.
Okay.
Yeah, I mean, you're still going to have a functioning kidney. They have to test you and make sure you have a nice low creatinine and a good filtration rate before they take one of your healthy kidneys out of you. So you have to be fine before they're going to allow you to donate. But then, yes, you do want to make sure you take good care of that one kidney. Because then if that one goes, you now have to look at dialysis and trying to get a kidney.
Yeah. And the good filtration rate is what again?
Filtration rate for the GFR is 90 and above, 80 and above.
Okay, that is good.
Yeah,
what
what is your filtration rate?
Mine says 91.
Okay,
Yeah.
very good. So see,
good.
you're taking good care of your kidneys. Keep it up.
Yes, ma'am. We're gonna keep it up. But I'm gonna drink more water.
Yes, water.
I'm gonna drink more water. Y'all saw me in here drinking a whole bottle of water, I guess the question is, our body is made up of how much water?
I think like 70%.
70% water.
Mm-hmm.
And so it's so important that we put what we're made of back into our system as much as possible. So just on that healthy tip,
Mm-hmm.
how much water should we take in per day to be healthy?
Oh my God, I think there is an equation, like your weight and your something minus something, but I would just say that the average is 64 ounces, 8-ounce glasses. 8, that's 16.
Okay.
So you've had 2 8-ounce glasses there.
Okay.
Yeah.
Very good.
Yeah. So you just need, a total of 8 is a recommendation. Some people need a little bit more depending on their body mass. Some people a little less. But we just say on average 64 ounces.
Okay.
There. Yeah.
So with that being said, 4 of these, we're good. 5, you're doing real good.
Yeah.
All right.
Yeah.
See, it's very, very simple, y'all. You drink 4 to 5 of these a day, and you're good.
Very good, very good. So, so we've talked about a little bit about management and treatment. So let's talk about, and we spoke about kidney failure. So when you get to the point of because we talked about kidney disease, chronic kidney disease. Now, kidney failure is when you get to end-stage renal disease or end-stage kidney disease, and they call it ESRD or ESKD. That's stage 5. Now your kidneys just aren't functioning at all, and it can no longer filter at all and cannot control the fluids in your body. So that's a life-threatening condition. You will die. Mm-hmm. Okay? So this is where you really need to be on dialysis and or get on, once you do all the proper requirements, meet the criteria for a donation, get on that list because the list is long. Almost every Hispanic and black person that's in any city on dialysis should be on the list waiting for some kind of a match, and continue to ask their family members to be tested. Life-threatening, unless, and then the great thing would be if they could get a transplant, because then that gives you many more years of life, good quality life. So let's talk a little bit about some of the things some of the symptoms you get when you get kidney failure. You can have your skin, keep in mind these toxins are still in your system. They're not being excreted. So you can have itchy skin and rashes, like I mentioned before, muscle cramps, because now your whole electrolyte balance, things like calcium, phosphorus, magnesium, sodium, potassium, all those things are out of whack, and they can cause problems. If your sodium, potassium, especially if your potassium is too high, it can cause arrhythmia with your heart, abnormal rhythm with your heart. Same thing with sodium, lots of cramping and muscle things. So these electrolytes and that we balance in our body are so important to being healthy and feeling healthy. So, and then when you do have dialysis, they do your blood test before and afterwards to make sure that your phosphorus and calcium levels are fine, because it'll affect your bone. Calcium, parathyroid, phosphorus, those things affect your bone mass. Then you start having more brittle bones and things. So it affects a lot. And that's why it's so much easier to just take care of your blood pressure or prevent your blood pressure and diabetes from even happening, or at least control it. So, because you're not going to get kidney failure or kidney disease if you control those basic health conditions.
Now, can I ask you about dialysis? I know that there was some controversy about dialysis clinics don't have doctors on staff, and they wanted to make sure they did have doctors on staff. And then there were some dialysis clinics that were not as clean as others. And then in the community, I'm hearing that there are very few, so people have to travel a lot further.
Yes, that's a lot of questions. So let me see if I can remember to answer them. Yes, dialysis units, just like healthcare, is a money-making business. So if you're into putting up a couple dialysis units in the neighborhood, because that's where you're going to find your most of your participants, the Black and brown community, you can churn them in and out. That chair, you just wipe it down and put another one in for another 4 hours, and they usually go around the clock. You can get an appointment at 2 a.m. till 6 a.m. To accommodate your schedule, because some people are still have to work. Some of them are not as clean as others. You do not need a doctor on the premises, but you do need a consulting. Everyone has a nephrologist, which is a kidney doctor. Every single person sitting in a chair should be controlled or taken care of by a nephrologist. So there should be on call, but there should be a nephrologist in control of that dialysis unit area. So if there's an issue, the nurses can call them. But they don't need to be sitting there doing anything, because there's nothing they need to do, right? Okay. The protocols are there, already set in place. You do this, you do that. If the potassium's this, you do that. The nurses follow protocols. That's what their job is. So I don't think they have to be there, but they definitely have to be accessible. And they're usually in buildings with medical personnel in there. So if anything, and then the best thing is if you have an issue, you call 911, and they transport them to the hospital. Because there's nothing a physician can do if they're having issues with potassium super high, and now they're starting to have some coding or heart issues. You got to get them to a hospital. So hopefully that answered most of the questions. For the ones that are not clean, you need to complain to the person that either owns them or runs them, that they should be better quality and more clean for people.
So dialysis units can actually be owned by non-medical people, but they have the money to get the machines.
Yeah, and set up a unit. And all they need to do is have contracts, MOUs and contracts with physicians and nursing staff and all that, just as you can own a bunch of nursing homes and don't know a blessed thing about a nursing home or how to take care of an elderly and all the medical conditions. But you need to have physicians that are going to take care of the elderly and also nursing staff. So, yeah, you can be a business owner. That's a business.
Okay.
Yeah. So some of the other symptoms with kidney failure can be just feeling really sick and your stomach bothering you and stuff like that. Stomach is really an issue. Urinating, so you're not going to be urinating as much. And when you get to end-stage renal disease, you may not even produce urine anymore. Yeah, very possible that you may not. You're going to be producing less, and you may not even produce any, depending on how far away. If you do have some, it can also be foamy and frothy, so it can look funny too. Bubbly. Those types of things. So the urine does not look normal because it's not normal. It's not being filtered properly. And then you're going to have some shortness of breath because kidney failure makes fluid back up. It's going to back up into your lungs. So now you're not breathing air. You have water on your lungs. like a congestive heart failure. So it's really hard to breathe when you have fluid on your lungs when it should be air in the whole lung capacity. And then you're going to have trouble kind of, your sleep patterns. There's a lot, it affects everything. Just like the liver affects everything, your kidneys affect everything. These organs were strategically made to be functioning well to make sure our whole body does well, right? So, and the same things. There's some things that cause kidney failure. Obviously, the ones I mentioned before, but there's some autoimmune conditions like lupus and some other types of things that can cause kidney failure. Some genetic conditions, like I mentioned, polycystic kidneys, and smoking and drinking can be a problem. Because keep in mind, now your body can't really filter that. So they say if you need to drink, if you want to drink in moderation. So like I said to the liver last month, the recommendations if you're going to drink is no more than 1 drink a day for a female and 2 drinks for a male. And it's not like 20 ounce or 40 ounce, it's, small drink. Those are some of the things that can happen. But then an acute kidney injury or issue can affect and cause kidney failure too. So I mentioned how you can know whether or not you have kidney problems, because you may not feel it stage 1 through 3. So then you need to do exactly what you just did. Number 1, go to the doctor and get your annual labs. And number 2, make sure you know what they mean. So if you don't know what the numbers are and they're falling outside of the range, because normally they send you labs on your computer or into your personal chart, that it'll have a number. And it may say it's high or low. What exactly does that mean? They should give you a range so that you know. And so if it falls in that range or it's a green light or whatever, then you're good. But you want to know if something should be higher or lower, right? So keep in mind that the numbers are so important. So knowing your numbers are key.
Now, isn't it overkill to request labs every 4 months?
Yeah.
Okay.
It depends on there's certain labs we are going to do every 4 months, but if you're a healthy person, your numbers shouldn't change that fast. But if you're following conditions, like if you're following diabetes and your A1C, which is kind of the average of your sugar control over 3 months, and you're not doing well and we're adjusting medications, we need to check it in 3 months to see how well you're doing. And if your kidneys are, have a stage 2 or 3, we want to check it sooner. But if you're across the board, 100%, everything is good, we can see you in a year for that. Okay. Yeah, I mean, if something happens, then we can check them, But yeah. So they're probably looking, oh, here he comes again. He wants his labs again. You're getting your money's worth.
Well, that's the thing. When I was younger, we go to the hospital when we get sick or whatever. But now that I'm older, I'm like saying, wow, I've been paying into this medical care for a long time. I want to get my full use of my medical. So every 4 months, I'm like, yes, I would like to have full labs done. I want to see where I'm at right now. And, my labs this time around, with my workout schedule, was much better than my labs last time. So,
yeah, if you do change your lifestyle, if you change your diet, we want to see what your cholesterol is doing. So if we tell you, hey, you need to do X, Y, and Z, and you are doing that, we will follow up, and that's a reasonable request. And I would say the most should be every 6 months just for the sake, but if you are making some changes with your diet, you now cut out sugar, you've now cut out fast foods or whatever, yes, you can request that because now your cholesterol is going to look better, all your numbers will look better.
Yeah, and Dr. Afflalo, I was told that I could only have 2 cups of coffee a day versus my 5 to 6
yes.
and everything. And I have, ever since they've said that, I have dropped it down to maybe sometimes only 1 cup a day. Good. But I did find me some decaffeinated coffee. They say I can have as much of that as I want to, but I still watch that also. But I'm always very curious, when I'm being told to do something. Heart palpitations have definitely stopped. You know what I'm saying?
That part.
All the good stuff that they say will stop once I stop drinking 4 or 5 cups of coffee, have happened. But I just wanted to see how the tests were. And, in this stage, as Black and brown people, we need to be more conscious and be more in tune with our body. And like I said, I've been reading those numbers for years. And I thought, oh, that's nice. I'm in the safety zone. I'm good. But now I look at those numbers differently with just the education that those are related to the kidney.
Yeah.
And I think that the more education we get, the more questions that we can ask, the more lifestyle things that we can change, but also we know what we should be looking for.
Exactly. Yeah. And when you do know that information and you make some conscious changes, when you go back and look at the numbers, even if they were good, they're better. So maybe your creatinine was 82, which is still in a fairly normal range. Now it's a 92 or 91. That's better. right? So it's filtering better because there's less caffeine, and yes, your palpitations will definitely go away. And if you're following your blood pressure should go down too. Even if it wasn't high, it's still going to get down into a normal range. So you're making all the right decisions. Most of the providers tell the patient, suggest things to do, but they don't do it. And then they come back the next month, their blood pressure's still high. We got to give them more medicine, and we continue to tell them, hey, you need to do this, this, and this. You don't need to be on 5 medicines if you just change X, Y, and Z. And believe it or not, when people make those changes, they can cut down their medicines and sometimes cut out their medicines.
Yeah, and that's one of the things. At one point, I remember taking 2 blood pressure pills. Now I only take 1, and that's been cut to the lowest dosage. And then they took, before it was 5 pills a day. Now I'm down to 2.
Yeah, that's amazing. That's wonderful.
Yeah.
You're a walking testimony, which you should be sharing with other people. I've just made these couple of changes, and look at the results. My numbers are good, and now I'm on less medications.
Yeah. And then, as you get older, I say 2 prescription drugs, drugs, but then, I still do the
supplements,
the vitamins, and everything else of that nature that gives me more things. Like you said, Doc, you need to get a good multivitamin and make sure that it's not synthetic. And so done that, and I order them in advance so that they're ready to come. But did whole research, you know what I'm saying? And I say I do. See, this is where it comes in when you had good to have a partner. Because she needed to get a good multivitamin. I said, well, baby, do the research. And when you do the research, do it for me too.
Since you have to do it, you might as well just go ahead and check with me, on mine.
And so we went through multiple things. And one thing I do love about having a partner and my wife is that she will go and ask questions, and she'll go to the stores and visit and really find out what's best and what's in it, and talking to the different people to find out what's the best vitamin that will give you the best results.
Absolutely. No, that's the right thing to do. Unfortunately, some people are not as motivated, and some of them just aren't on a lot of anything. That's all well and good too, but if they don't eat right and they don't take vitamins, then if their body starts acting funny and they start feeling weird or they're tired all the time, they need to stop and take a look at the situation. And I'm proud of you for, number one, going to the doctor, asking for results. When the doctor makes suggestions, you're actually paying attention to them and incorporating them into your daily life, which shows results. So we're not making this stuff up. As I tell the patients, I said, I'm not going home with that disease. I'm here to explain to you what you have, try to give you as much information so you make the best decision possible for yourself to live a healthy life. So our job as providers is to educate our patients. That's our job. If we don't do a good job, if they go home with more questions, then we haven't done our job properly. Yeah. And we should make it a very safe and comfortable environment so that they feel comfortable enough to ask questions. Most patients are, and they don't know why they're taking medicines. When I see them, well, I'm taking a little blue pill and a purple pill and one large. I'm like, well, what are they for? I don't know. I said, can you just write them all down next time with the doses? And I can explain. So I tend to put on my prescriptions what it's for. Such and such and such, a statin for cholesterol, such and such for blood pressure, such and such for heart disease. Because they're taking a half a dozen pills, how are they going to know? But if they start seeing the color, the name, and what they're for, they'll start getting more educated. So we as providers need to do a better job of educating them, telling them why we're giving them the medicine, the importance of it, and what it's for. Because they're taking a lot and they don't know what they're taking it for.
Yeah, and one of the things that we did find out, even when working with my mother, is that we always had all of her medications written down. So every time we went to a doctor, instead of them saying, could you tell us what medication you're on, we would hand them that. And then, nowadays it's on your phone. And they just take a picture of your phone and they'll know exactly. And nowadays when you go into the offices, everything's on the computer, and they'll just say, are these the medications?
Are you still taking these? Yes. Yeah. And that makes life a lot easier. I mean, the electronic medical record has really revolutionized medicine, but also made it safer, because we can no longer, the horrible prescriptions that you used to write that would have a decimal in the wrong place and they could overdose the patient. There were things like that. So now, the pharmacy will catch those things, and say, is this what you meant to write, Dr. Afflalo, or whatever? But everything's in the computer. And the computer will let us know if there's something we're about to prescribe that interacts with something else on there. There's warning, this interacts with the statin, maybe consider changing something else, or override it if you know that they've taken it before and they're not having a side effect to it. So it's a lot more safety in the electronic medical record now. And then you also don't have to worry about reading the scribble of your consultant colleague that's sending something over from pulmonary or whatever. You don't have to guess at what they did. It's on the chart. You can see the MRI. You can see the CAT scan, the chest X-ray. It just makes medicine easier to practice, and it's safer for the patient. We all are on the same team, and all the information is on the medical record.
Wonderful, wonderful. So, in addition to dialysis, I've seen sometimes where they say the port gets clogged and they have to put new ports in. So, the process of preparing for dialysis, is that a surgical procedure first and then you go
Yes.
into dialysis?
Yeah, because you're going to be stuck 3 times a week, and most people have problems with getting access to their veins. They put in a shunt, usually in their forearm somewhere, occasionally on their upper chest, but their forearm. And it's a shunt that's a larger area port where you can just stick the needle in. You can be, just not even watch where you're going, just poke it in because it's wide enough. And the shunt you can see on the forearm. And then you just place that in there, and that's where that whole dialysis of pulling out your blood, filtering it, and putting it back in takes place there. But occasionally there can be complications with the shunt, which means they now have to find another port to put in, because you definitely need that in order to successfully be able to pass the amount of fluid over those 4 hours of filtering everything in your body and allowing it. So then you have like a couple days off, because most people go 2, no more than 3 days before they need their next dialysis. And that's the one part about being on dialysis that it really limits you in traveling. You have to find a dialysis place if you're going to go visit family in the South or somewhere. You need to set up dialysis in the place where you're going and get it all scheduled and worked out before you get there, so that you get your dialysis on Friday here in San Diego and you're going to Louisiana. By Monday you should be in that dialysis unit over there getting your first dialysis, and if you're there for a few weeks, you need to have that set up, so you can't afford to miss it, because you can get toxic.
So my question is, if dialysis is designed to pull out toxins and fluid off of you, why do they have so much saline or water things at the unit? It seems like there's water. Is that the filtering?
Well, there is some filtering going on. It doesn't pass through water,
Okay.
but there's so many things that helps the machine work.
Okay.
So I'm not sure exactly what you're referring to, but the water doesn't go in your system. The
Okay.
blood comes through, filters through some devices that has filtering things,
Yes.
and then it comes out on the other side of the unit, whole blood that's now healthy,
Yeah.
and you can utilize for the next few days, 2-3 days.
Yeah, my mother was one of the people that were fortunate enough to be able to do home dialysis. And what I noticed is that they would put these big boxes of saline, and they would come and they would give you a ton, and it would be like, okay, this is the 30-day supply or 40-day supply. And when you set up the machine, you had the filters, and then you had the water. And I was saying, well, what's the water for?
Yeah, it probably, because I'm not that familiar with the home devices, is getting much more prevalent now because it's more convenient, but you're on it like 12 hours a day, every day, so it's more convenient being at home, but then it's more limiting in your freedom because you have to hook back up. Usually it's overnight, while you're sleeping. But there's all kinds of different machines, and yes, water does help the processing of the filtration. You have to ask a technical person for all of that, because I don't know how much water it actually uses to make it work.
Yeah, and one of the things I found, I know some people that go to the clinics and their appointments at 3:00 in the morning because that's the only time that's available, or they have to go further out and things of that nature. And we appreciated being able to make sure that our mom didn't have to get up and get into an ambulance or something to go get that. But originally, and this is one of the things I think was really sad, is originally the hospitals were saying that it was impossible to do home dialysis, and having someone in our family that is very proactive and did her own research, found that San Diego was a test site and had a whole unit here, and went back to the doctor and said, well, not only did I find it, but it's based here in San Diego. And the first question that they asked was, well, how did you find it? My question is, why is it that some things, when it comes down to health, is only given to, well, let's say, the more privileged than to the community that it would serve better?
Okay, you already know the answer to that question.
Yes,
You
I
know,
thought so.
we have structural racism in everything, but especially in medicine. So, yes, number one, the person may not have even known it. They should, if it was the nephrologist, they should be up on things, but they're not always up on things. So, if it's not the normal procedure, they're not going out of their way to see. Well, you know what? We haven't done it before, but let me see if I can't investigate and find out if I can get you on it. So they take the easy road of no, sorry, it's not available, and you have to do your own research and be your own advocate, especially as a black and brown person, because they will minimize the treatment. A lot of people just don't care. Yeah, when they see you come in, they're like, oh, okay, another one. And the reason why they have chronic kidney disease is because they were non-compliant. You know, they were a bad patient. Their blood pressure out of control. They make assumptions. So they already put you in a category, and so they really don't want to. You're like a bother.
Yeah.
But that's what keeps nephrologists in business. Is all this dialysis stuff and all this chronic renal disease. So yes, unfortunately, black and brown people, you do need to be your own advocate. And you need to, if you know there's something out there, ask questions, do your research, and then go back to the doctor. And if that doctor's not willing, find another one.
And I think that's what's so great about IWC primary care is that you're providing a safe environment to ask just those questions. And I think you go up and beyond the call of duty to make sure that your patients are educated and are able to make well decisions. And so it's not just like, let's how they say, like a cattle drive, round them up, push them out, let's go. I think with IWC primary care, what we consistently hear is that they feel like they're at home and they're with family and they're comfortable enough to ask and have those difficult conversations.
Absolutely. And we definitely listen to them, and we're going to try everything in our power to make sure that we meet their needs. If it's something way out of left field, we can talk them back down and say, let's try this first, and then we'll go on to that. So there's always negotiation and compromise and making sure that they feel heard, validated, and not ignored, and then they go out happy. And you have to build up a level of trust, right? So once you trust your provider, everything else is gold.
Rumor has it is that y'all like Big Mama. People come in and Big Mama just look at them like, now you already know the answer to that one. We're going to have this conversation again, but baby, you already know what we're going to have to do. You don't believe fat meets greasy, but it is.
It is, and you don't need it. Yeah, no, we are definitely a nurturing group over there. Our thing is to make sure we respect and take good care of our patients, and that they feel like they've been listened to, but they feel empowered, because we can't make the decision for them, but they feel safe enough to make the decision based on the information we've given them.
Okay. So with kidney disease, kidney health, if you were to give a kind of a rank order of things that people need to do to make sure that their kidney stays healthy, and then some warning signs that they might need to go get checked out, what would those look like?
Number one, as you did, if they get their annual wellness exam or their annual exam and get their routine labs, kidney function is in the routine labs, along with diabetes, cholesterol. Those are basic things, a blood count. So they should get a number every year. And if we start seeing it creeping up, they're not going to be symptomatic for years. But as this starts creeping up and the numbers change, the creatinine gets larger, the filtration rate gets smaller, the conversation needs to be had. And they should be watching their diet. So as we mentioned already, for their chronic medical conditions, they have to control their blood pressure, they have to control their diabetes, they have to control their weight, and then they have to watch what they're eating. Because when you get closer to end stage, you've got to minimize your protein. We want you to have clean, healthy protein in your diet because you need that for building muscles and staying healthy. But too much of it makes your kidneys, when you're on end stage, too much of it makes your kidneys work harder. Yeah. You also have to minimize the amount of salt. So you have to watch a teaspoon is almost 2,300 milligrams. You shouldn't be having more than that in a given day anyway. And so, you need to start cooking at home. Outside food is 75% highest in salt, right? So processed foods, packaged, canned, those types of things, unless you buy canned that says no salt added. So just the diet in terms of minimizing the amount of salt. When you get to end-stage renal disease, you have to also limit your fluids. And fluids means everything that's liquid at room temperature.
Okay, we're going to say that again.
So anything that's liquid at room temperature is considered a fluid.
Okay.
So, like a Jello is not liquid, but it's a fluid. So you have to count when your nephrologist says you have to limit it to X number of cc's or milliliters of fluid, you have to count everything in there, including the ice cubes that will melt and be a fluid. So you have to really be restrictive because your kidneys cannot filter the extra fluid out. So you've got to count the amount of cc's of fluid you're taking in.
And that includes even if it's water, right?
Yes. Okay. Water and anything that's liquid at room temperature is considered a fluid that you have to monitor. Including like heart disease, when you have congestive heart failure, you can't just drink anything you want to. You have to limit the amount of fluid you take in, or it causes your heart to fail and fluid to back up into your lungs, and then you're on Lasix and your ankle swell and all that, shortness of breath. Kidneys, you have to limit the amount of end stage, limit the amount of proteins, make sure that they're lean proteins, limit the amount of salt, and limit the amount of fluids you take in order to keep the kidneys as healthy as possible until you get that transplant kidney that you're on the list waiting for.
But then even if you get the transplant kidney, you need to be on a healthy diet and take care of it so that it will last much longer.
Yes. And you're going to be on suppressants. You're going to be on a lot of medications because now you have a foreign thing in your body. So you need anti-rejection medications, some steroids and things like that. So your body, you're now, you're just going to be putting in a handful of pills in you, but you need it to keep that kidney healthy and to not reject it and make it fail on you. And yes, you have to eat a healthy renal diet.
Okay. With that being said, we're close to the end of our show. Let's go back to the clinic that's coming up here on May 7th, 2025 from 10 a.m. to 3 p.m. The Community Health and Resource Fair, first Wednesday of every month. Let's just talk about it once again and let's push that.
So since we're preparing for May is Mental Health Awareness Month. So we're talking about mental health in terms of anxiety, depression, anything, any form that it comes in. It's a stigma still in our community. We need to get rid of that stigma. It's a health condition that we want people to seek attention, go to a therapist, go to a psychiatrist, do whatever you need to do to be diagnosed properly and to be treated properly, or to just get counseling. You may not need medications. You may just need to get all that stress out of your body. But mental health is so important, and we're all suffering with it to some level of degree. Some people can manage it well and it doesn't affect their life and their health, but others it really affects them. And so just know that we're focusing on mental health. It's Mental Health Awareness Month in May. Please go and seek help if you're having any challenges. There's all kinds of, 1-800 numbers. There's people in our community that provide mental health therapy. So go and seek that. But the other than that, our regular health fair is all about the chronic medical conditions, trying to either prevent them, control them, or at least diagnose them. So by coming there and getting free testing, you can now know whether or not you have diabetes or if your blood pressure is out of control. And so with that, we just want to provide that service so that you're never guessing what your numbers are.
And again, it is a community-free service that happens every first Wednesday of the month at the Jackie Robinson YMCA, 10 a.m. to 3 p.m. I always try to tell people, get there earlier because everything is happening. You can get through and enjoy the festivities that are there, but also you can see all of the different wonderful services that are being offered in the community for free. Dr. Afflalo, I enjoyed this because, we like to ask Dr. Afflalo our questions, and I know that a lot of questions that I might have asked, people might say, oh, yeah, that's a good one. That's the one I want to hear. And we want to encourage you all. We do this every fourth Thursday of the month, and you could always send in your questions in advance. If you have questions, this is not a diagnosis. It is a conversation to challenge you to go see your provider. Can I get amen?
Amen.
With that being said, any final words?
No, just have a wonderful evening.
Thank you all so much for tuning in. This is Ask Dr. Afflalo right here on GODRadio1.com.